So, Namaskaram to all. I, Dr. Preetibhai Sahu, welcome you all to PARVA 27 of PRABODHINI webinar series. As we all know, before starting any good work, let us seek the blessings of Lord Dhanvantari. So, we will start with Dhanvantari Vandana.
नमामि धन्वन्तरिम् आदिदेवम् सुरासुरे वन्दित पादपद्मम् लोके जरारुकभयमृत्युनाशम् दादारमीशम् विविधौषधीनां धन्वन्तरिं रमानाथं सर्वरोगनिवारकम् आयुर्वेदप्रवर्तारम् वन्दे पीयूषदायकम् सर्वे जना सुखिनो भवन्तु सर्वे सन्तु निरामया ॐ शान्ति शान्ति शान्तिः
Om Dhanvantara Namaha. So, with all the blessings of Lord Dhanvantari, today we have reached PARVA 27 of PRABODHINI webinar series. Our guest speaker has arrived, Dr. Prasanna.V.Joshi Sir. Namaskar, sir. We welcome you all to today's webinar, and we are very eager to hear from you. And I know our all participants are very eager to hear from Sir. They all know Sir is very renowned and he has a very vast clinical practice, and he will be sharing all his experiences with you all. But before starting the webinar, let me just revise rules and regulations of PRABODHINI webinar. PRABODHINI webinar series is organized by Shri Babu Singh Jai Singh Ayurvedic PG Medical College and Hospital, Farrukhabad, UP. As we all know, Ayurveda is the gift of our ancient sages, but it is written and transcribed in a formulary basis, and it is written in the form of specific shlokas, which is very difficult to understand. And it is essential for us to have a guru, a guide who can extract the actual meaning of all these shlokas and help us apply these in our practice fully. So we thank our patrons who gave us this platform to achieve these gurus to get maximum out of them. Our patrons, Dr. Shailendra Yadav Sir, Chairman JS Group, our Director Ma'am, Dr. Sunita Yadav Ma'am, and our principals from Shri Babu Singh Jai Singh PG Ayurvedic Medical College, Dr. Manjunath NS Sir. We, the organizers of PRABODHINI webinar series, Dr. Nihar Ranjan Manta, Associate Professor from Shri Shri Narsinganath Ayurvedic College and Research Institute in Panchakarma Department. I, Dr. Preetibhai Sahu, Associate Professor from Chikitsa Department, Shri Shri University, and Dr. Srinas B.S., Assistant Professor from Panchakarma Department, Shri Babu Singh Jai Singh Ayurvedic Medical College and Hospital. We started this journey from 25th April 2023, and today we have reached PARVA 27. It is 1st September 2025, and many gems, many knowledgeous people accompanied us, helped us, guided us in our journey. And today we have Dr. Prasanna.V.Joshi Sir, who is ready to guide us today. And the rules and regulations, registrations is mandatory. Registration is done through filling in the Zoom forms provided in the link. After filling in the Zoom forms, you have to join the WhatsApp group PRABODHINI through the link provided, as all the further proceedings will be intimated in the group. On successful submission of the form, you will get a confirmation mail containing Zoom meeting joining link. Please join the webinar with the link provided, as it is individualized and separate for all. So your name and email ID in the Zoom form should be correct as it will be used in your e-certificate. So be very careful while filling in your Zoom forms, your names and email IDs. And if anyone is joining this webinar with any other email ID, then please inform us because we will be able to provide you e-certificates properly. So e-certificates will be provided to all the participants attending the webinar more than 45 minutes. You will get your e-certificates through email ID registered with us within 7 days, and thus there is no need to share your email IDs during the webinar sessions. So please be very attentive and try to make all things out of our guest speakers today. Utilize this 1 hour to the fullest of your, and thank you for now. Now I will hand over this session to Dr. Ningamma ma'am, who is Associate Professor in Pancharama Department, Shri Babu Singh Jai Singh Ayurvedic Medical College. She will introduce you to our guest speakers and she will take this scientific session forward, followed by Q&A session. So please be prepared for asking your doubts to Sir, and he will surely solve them. So Dr. Ningamma ma'am, hand over to you. Thank you so much.
Thank you, madam. Good afternoon, respected dignitaries, colleagues, PG scholars, students, and delegates. It is a great privilege to welcome and introduce our esteemed guest speaker, Dr. Prasanna.V.Joshi Sir, who is a person of virtue and simplicity with huge knowledge that made him unique, which manifested all his achievements in the field, which is truly inspiring. So we welcome Sir, who has graciously joined us to share knowledge, insights, and inspiration. PRABODHINI webinar are meaningful because they provide us with the opportunity not only to learn but also to connect with people. Our guest speaker, Dr. Prasanna.V.Joshi Sir, presently working as Professor and HOD, Department of Kaya Chikitsa, Sri Vijay Mantesh Ayurveda Medical College, Ilkal. Sir completed his PG from DGM Ayurveda Medical College, Gadag, and UG from SVM AMC Ilkal. Started their academics in 2009. Sir completed 25 years in both academics and practice. As a guide, Sir guided more than 50 PG scholars and treated more than 75 patients successfully and have built an outstanding reputation in the field of Ayurveda in a small town like Ilkal, running Vasudha Ayur Care, a Panchakarma center, and training the students for Ayurveda practice with Panchakarma, Marma, cupping, etc. different therapies. The students who got trained under Sir are practicing Ayurveda practice successfully with confidence. As today's topic itself says, Sir's specialization in treating psoriasis, eczema of more than 10 years of history, and Sir is specially treating dermatological, neuromuscular, infertility, psychiatric, diabetic wounds, hypertension, etc., especially chronic fevers which are not cured through antibiotics and antipyretics like malaria and typhoid. Sir treated successfully only through Ayurvedic medicines and also treated special cases like avascular necrosis, brutal varicosis of third degree. To highlight just a few of his accomplishments awarded as Shikshaka Bhushana and Charaka Ratna by different institutes. And also Sir conducts Samhita Adhyayana for students daily morning 6:30 a.m. to 7:30 a.m. regularly since 9 years. Beyond titles and awards, what makes Sir truly remarkable is his ability to inspire and guide others. Over to you, Sir.
Namaste, madam. Namaste to all. So, Punavasu Atraya Gurubhyo Namaha, Dhanvantare Namaha. So I'm very much thankful to all the organizers in Dr. Nagaratna, Magari, and other organizers for giving me this opportunity to speak about that psoriasis studies. So starting with the topic it is. Slide. We'll start the topic directly. So if anybody asks, that is, what is the line of treatment for psoriasis in Ayurveda? Maybe eczema, any other skin disease. It is very difficult to say in 1 or 2 lines because there is a kushtaha or that skin disease, the group of the skin diseases, they are having multi dimensions. Saying in 1 line becomes difficult. So according to different stages and all, we should go on that is selecting the different that Aushadhi yogas and all. So that is a big problem it is. So that is what, if you say that kushtaha, kushta chikista, if I thinking that by reading kushta chikista I can treat it, I think I may be wrong. Because kushta is having multi-dimensional, already I told. So starting from Jara Chikista, concept of Jara Chikista, concept of Visappa Chikista, then concept told in Vatarakta and all, even that Visha Chikista, because that Vishas, that is also having, that is skin manifestations. For that, we have to understand the concepts of Visha Chikista also. If it is because of Garavisha and all, then I have to use that Agadas. So for that purpose, it is having multidimensional. So we have to understand the concept, then we should go for the treatment aspect. But what repeatedly I'm telling, that the concept is like a gun and medicine is like a bullet. Right. So if the person knows how to shoot it, then only he can shoot it to the targeted part. Otherwise, it is difficult. It is difficult. So just one example, I will tell that concept and that medicine. If a patient with a complaint, that is having that Agni Mandya, Bhattamala Pravrutti, then that Sandhi Shulaha, Sandhi Stabdata and all, with such a complaints, patient come to the physician. Then if he don't know the concept, then for Sandhi Shula and Shotaha, he may give one medicine. Then for Bhattamala Pravrutti, one medicine. For Agni Mandya, one medicine. So like that, 3 to 4 medicines will be prescribed. If you know the name of the concept, that it is Samavata, then he can give only one medicine like Ajamodadi Churna or Panchasamat Churna if it is given. So that Ajamodadi Churna, it is Shotagnaha, Shulagnaha, Agnipadipakaha, Vatanlomakaha, it gives Badamala Purti also. So like that, if we know that more and more concept, we'll use less and lesser medicines. How many the lesser concept we know that much more and more medicines will go on prescribing. For that purpose, I think we should understand the concept, then know to prescribe the medicine. That is a good method. That is. Now, coming to the skin, just I will go for a little bit introduction to the skin and to the psoriasis and Kitiba, Epicusta, etc. Then I will start that case study. It is. So we know that about the importance of that skin. It is socially, cosmetically, everything. Then physiologically, it is important. So for the purpose of immunity, then it is that is the part. The skin is the part which is exposed to the external atmosphere much more. So and injuries they occurs, infections they occurs. So it is tolerating all those things. And as it is the visibility, it is there. So emotionally, physiologically also, and I told socially also, that part becomes important. So physician should be very much careful while treating that skin diseases. I told physiologically protection. It gives a protection and it plays a role in the immunity also. Cosmetic and social problems are also involved in that skin diseases. Coming to the psoriasis topic, it is 2 to 3 diseases. We compare it with the psoriasis. Some says Kitiba is psoriasis, some other Ekapushta is the psoriasis. Still, some other the articles and all I read, some other physicians opine that it can be compared with the Siddhma also. That is psoriasis is as a Siddhma. As there also that powder-like thing it comes out by scratching and all. It is compared with the Siddhma also it is. Coming to Kitiba and Ekapushta, majorly, they are compared with Kitiba and Ekapushta. So if you see that Lakshanas of Kitiba, that is Shavavarna Mandalas and Kinakara Sparsha. 2 main Lakshanas are told. Shavavarna Mandala and Kinakara Sparsha, according to Charga Samhita. But the main Lakshana of the psoriasis is the itching. It is not there. Kondu is not there in Kitiba. You see that Ashtanga Sangraha in that Hindu Tika, he opines that Kondu is there. So we can say that according to Hindu, that Kitiba that can be taken as that is the psoriasis it is. So Shavana mandalas, that is circumscribed patches are there. Kinakara sparsham, that is Chakrapani says, Kinakara means Vana Vastuhu. Vana Vastu, after healing the wound, that is a scar it occurs. That scar it is having Shavanaha. If you scratch it, that powder-like thing it comes out. I think that it can be compared with the candle grease sign in the modern. So that is there in Kinakara sparsha. Because of that, we may compare that to Kitibaha. But anyhow, if you see that patch they told, it is like Kinakaraha Vana Vastuhu. Coincided that wound may be there, after healing that much of scar may be there. So that much of size, that is psoriasis. So that can be taken as Kitiba. That can be taken as the Kitibahitis. Next is that Ekakushtaha. You see that classical Lakshana, they told Asvedanam, Mahavastu, it covers more area. It is there. If you compare it, Mahavastu, then Masta Shakalopapam, it is told later, the plaques are present. By seeing the Lakshana, that can be compared with the chronic plaque psoriasis. Okay, that Ekakushta can be compared with the chronic plaque psoriasis. That type of psoriasis can be compared. It is. See that Lakshana, so they told Masta Shakalopapam, that is the scaling is like the skin of the fish. So that type of the scaling it is presented as. Okay. Then some other says it is Abrakapatra Samam. Same it that indicates the scaling, silvery like mica. So that is there. So erythematous plaques are present. So that can be compared with that is a psoriasis, the plaque psoriasis. Coming to a small introduction to psoriasis, what is that psoriasis exactly? Psoriasis, it is a common chronic immunomediated skin disease. It told that chronic and immunomediated skin disease. So if any immunodeficiency, the syndromes are there, diseases are there, they are going to affect much more. They are going to trigger that psoriasis also. And it is characterized by scaly erythematous patches, plaques, and sometimes papules may be there, which are usually pruritic. That type of papules may be there. It is. Okay, so this is a common that some symptoms is I told. Coming to the classification, you have to see it keenly. That is one type of psoriasis. There is a guttate psoriasis. Guttate psoriasis. That gutta means a droplet. See that picture. Very small patches are there. You can take it as the spikes. I have to call it as not the patch. Spikes. The spikes are present. And if the patient rubs or scratching is done, powder-like thing it comes out. If you see the Sidmaha, there also they told at Urasthana it occurs, and that Rajaha, it comes out, it is told by grustum, by rubbing, that is powder-like thing it comes out. So sometimes it may be confused. But that Sidmaha, if you see that that can be compared with there are some other conditions. That is then not see that picture. Spike like that is the patches they occurs, very small size patches are present. If the patient rubs, then that is the powder like thing it comes out. See, commonly where it occurs, it is told it is seen in the children's. Even I have observed in the adults also. But these are the triggering factors. That is the respiratory infections or the tonsillitis and all. So they are the triggering factors. So it may occur because of that also. The strongest association is with HLA antigen. It is there. Guttate lesions may also occur in patients with chronic plaque psoriasis. Combined things we may get it. Plaque psoriasis and guttate psoriasis, like that combined things may be there. It is as a presentation. So this is guttate psoriasis. Still clearly you can observe it in that picture, in that image. It is how it is. So such a patient comes that confuses a lot in the OPD. And so psoriasis means we are having a different type of, that is a picture in our mind. So the scaling is like just like a onion, the scaling is present, the powder like thing comes out, we are thinking like that. But this type of patients, we will not take it as psoriasis. We are getting it as other like conditions I told, maybe like a Sidmaha, it is. So that is the problem. Then another problem with the skin disease is the basic lesion is important. Okay. For example, if I say that is Vicharchika. Okay. After 1 or 2 years of history, the patient comes to me, it may be having a patch. Okay. Just like I told the Shavanaha, that type of mandala may be there, patch may be there, it is. So it may look like Dadru. But if you ask the history, then the patient says that is the pedakas are there, Srava started, then conduit is there. Then we can say it as Vicharchika. By present, that is the observations, if you are deciding it, then that may confuse a lot. For that, you must ask about the basic lesion of the skin disease. So this is a chronic plaque psoriasis. So almost all, this is a common thing, common type of psoriasis, what we are getting, almost all 90% of the cases it is. So it manifests as a coin size to large palm size, maybe in bigger in size it is. It is well defined, and more squamous that the plaques are present, may be distributed bilaterally. That is the main nature of this type of the psoriasis. So distributed bilaterally it is. Next is pustular psoriasis. What the patient I got. Next, just as an example, I'm going to share my clinical experience with that patient. So pustular psoriasis, I got it. This type of psoriasis that is filled up with the serum, rare it is. Okay, we are not observing the secretions in the psoriasis. Maybe as secondary infections, it may occur. But in pustular psoriasis, there that the serum is there, serum is present, and secretion it may start. Okay? Then, according to the different places, also they are named like scalp psoriasis, palm psoriasis, plantar psoriasis, and all, depending on the place where it manifests. According to that, these different types of psoriasis they are named. These are the nidanas. We know that just viruddhaharaha. I will take it as food and food reactions. Viruddhaharas, and it is quite common. So then that next is Shita Ushna Viparyayaha. Just to understand it, that is the changes in the seasons and the climate. So definitely, in the cases of that kitiba and that is that psoriasis, we are getting it in the cold season. It aggravates like anything. Then Shita Ushna Viparyayaha. So I will take it as, for example, if the persons are working in an AC room for 6 to 8 hours, they are coming to the external atmosphere immediately. If they come to the external atmosphere immediately, then that skin cannot adjust to the extreme variations of the temperatures and all. So because of that, such a changes may occur. So not only the psoriasis, the conditions like that is Shita Pitta. I observed such a cases also. Because of such variations, they may get the Shita Pitta like condition. So that may cause. Then the next is important. Ayurveda says, that is what I am telling. Kodaha, Shokaha, Bhayaha, psychological factors. They are included under the hetus of the kushta. Most probably, they are neglected while giving the treatment, isn't it? So we'll focus on Shodhana, Shamanaha, Tikta Kashayas are given, but we are not thinking about these psychological factors. Even the modern says it is psychosomatic psoriasis is. So it may aggravate because of such a factors. And I got one that is not only the psoriasis, other the skin disease also. I got one patient of Shita Pitta, which had almost 10 years of that is the Shita Pitta. A lady of 40 to 45 years old, she came to me. Then I also treated it like Shita Pitta only in the beginning stage. I went for the Virechanaha, other Shamana Yogas and all that is given for 2 to 3 months. There is no results at all. But once the patient became close to me, then I asked her. Then I asked about the history and all. They started telling about their personal problems. Then I came to know that the patient is having a lot of the stress and strain. Because of that, it is manifested. Very interesting is, in that Ashtanga Sangraha, they said Brahmi Grita is indicated for the Kushta. Brahmi Grita, in Falashruti itself, they are telling it for the Kushta. They are telling it for the Kushta. So then I given that Brahmi Grita to that patient, started giving that Brahmi Grita to the patient. Within 1 month, I got the result. Within 1 month, I got the result it is. So like this, that psychological factors, they play a very important role in treating the Kushta. So for that, a proper history is essential, especially related with that psoriasis and kitibaha. So even though Shirodhara is not a main line of treatment, it's not a main line of treatment, but if the patient is having such a history, after Shodhana Karma and all, which some of this, we must go for that is Takradhara. In 2 ways that gives a benefit, that is Takradhara. That is, one is localized effect will be there if it is a scalp psoriasis. With that, for the stress and strain also, it works better it is. So for that purpose, we have to do that Takradhara if such a cases are there. Then Atapa Sevana, sunburn, I told Shita Ushna Viparyas and all. So because of that, it may occur. And according to that, the medicine should change. See, I told that Shitaha, that is that cold atmosphere, that is the triggering factor for such a condition like psoriasis or the kitibaha. Shita also causes kitiba, Ushna also causes kitibaha. This is interesting, isn't it? So you must ask the history. Okay, commonly, 70-75% in the course it aggravates, but some other patients may be there because of Ushna Hetuhu, so it may aggravate. So same thing, this is also psoriasis only. I got one patient in the extreme summer, especially in North Karnataka. Summer means it is like anything, it burns like anything. In that season, the patient came to me. He had all the signs and symptoms of the psoriasis, severe itching. But one thing I noticed, that is a pinkish discoloration of that is the skin over that patient. It is, and that was the I told the summer season. Patient also told that he is wandering here and there, so because of that he got it. As Ushna Hetus are there, I used Hima, Sariva Hima. Okay, Sariva and Ushira both we mix in equal parts. Ask the patient to take that Himaha. With that Sariva Lepa it is done. So without to show them, we got the result. Okay, so only by thinking, see, classically it is told that Kitibaha is Vata Kavajaha. We must give Ushna Chikista. But always we are not getting such a thing, such a patient which is told classically. You must go for Hetu Viparita Chikista. For that, you must take a history proper. It is. If it is Ushnaha, then we have to use Sita Viratavyas like Ushiraha and that Sarva and all. Even the Sarvadya, so that is given to the patient. It is. Then without show that within few days, we got the results. Okay, so that is about Ushna and Sita Hetus. We must classify it. Okay. Then Abhigata to the Twacha, when Ayurveda also says, then modern also says physical trauma to the skin. Physical trauma to the skin, it may occur. Some of the types of vishas already I told. This concept of visha we have to remember. I think we have to read that visha chikista thoroughly. A number of that visha lakshanas, they are going to be manifested through the skin only. It looks like a kustaha. You may go for shodhana. Shamana may be given it is. But you must give that agadas. You must give the agadas. Otherwise, we are not going to get the results. In such cases, it is. For that, I think we must concentrate over the visha also. Then, so this is one phenomena that is called in the modern. That is external injury, maybe because of trauma or by chemicals. If the injury occurs, chemical will take it as vishas only. If it occurs, so that is called as Koibinar response. It's called as Koibinar response. What is Koibinar response? Because of physical, chemical, or mechanical traumas, or by allergy, wounds, sunburn, etc. If it triggers, so that's called as Koibinar response. Koibinar response. It is the same thing told in Ayurveda also. Twacha abhigata, some type of vishas and all. So that may cause the kusta. Then therapeutic causes. Panchakarma apacharaha. You know that in Vamana Ayogaha, that is Utkotaha Kanduhu, it is told. So like that Panchakarma apacharas, they may cause. This is a Vaidya Kritaha. So you should be careful while conducting the Shodhana Karmas. Shodhana Karmas are conducted to treat that skin diseases. But in a proper way, if it is not done, then itself may that is aggravate that condu end up. So for that purpose, we should be careful. Then Ati Ushna, Tishna, Taila and Lepas. So already, if the patient is having the history of the psoriasis and all, see, we cannot say that patient is having psoriasis and they will come with the problem. Okay, past the patient had the psoriasis, now he may be having the Sandigata Vata. He may come to me. Now I have to go for the lepa. If you give the lepaha with that Dashanga lepa, for example, which contains that is Kushta, etc., Ushna Viradravas are there. If you give it, then it may aggravate. So such a cases may be there. It may trigger that factor. It is Ushna, Tishna, Tail and Lepas. So that may aggravate the condition. So then it may cause even that psoriasis also. For that purpose, while going to the external, the Lepas and all, we should be careful. In modern also says some of the drugs they causes the psoriasis. Diphtherial vaccine. So they are not the causative factors. These are the triggering factors. Diphtheria, because it is an idiopathic. Psoriasis is idiopathic cause. There is no specific cause for that. These are triggering factors. Diphtherial vaccine. Then beta blockers, anti-malarials. For a longer period or repeatedly, if the person takes anti-malarials, so these things sometimes they may be deposited at the subcutaneous layer. If the person is exposed to the sunlight, it reacts with that. Then it may cause different the skin disease. So I had one patient, almost 10 years back it is. The patient had hyperpigmented patches almost all over the body. hyperpigmentation. It not only over the face, all over the body. Then patient told me almost for 2 to 3 months because of reoccurrence of malarial fever and all, had taken that malarials repeatedly. So after that it was started, he told. So that chance it is there, anti-malarials, we should be careful about it. Next is very important for the practitioners, that is corticosteroids. This is called as rebound phenomena when stopped. So in Ayurveda, we are having a number of treatments for psoriasis and all. I think if you come to the contemporary medicine, definitely they will use corticosteroids. In the beginning stage, it subsides. But how many days they have to use it? At one stage, they have to stop it. If they stops, then they told that phenomena, rebound phenomena, when stopped, it reoccurs. That, see, at that stage, the patient cannot give up it and he cannot take it. That is the situation. It is just like that is riding a tiger. Okay. If a person is riding the tiger, what happens is that is, okay, he should ride it. Okay. If he coming down, it eats. And how many hours he should sit over the tiger only? That becomes difficult. So this is what better ask the patient that they should not take corticosteroids. If extreme situations are there, that's okay. But in the beginning stage, they should not use corticosteroids. And I observed the patient, whoever taken that corticosteroids, even with Ayurveda medicines also, we are not getting the better results. If they are not used corticosteroids, results are better. Results are better. So that is the chance it is. For that purpose, better not to use the corticosteroids. And this is a plus point for an Ayurveda physician. Okay. So I have treated a number of cases with the Shodhana and Shamanas. But the thing is, with the corticosteroids and what that patients I observed, I told that the results are not that much appreciable. Okay. So this is a plus point to the eye of the physician. Without using corticosteroids, we can manage that psoriasis. After giving Shodhana Karma for 10 to 15 years, there is no reoccurrence at all. Such a patient also have seen. After giving that Shodhana Karma within 6 months or 1 year, once again started. That is there. The reoccurrence, it is there. We'll accept it. But at least by not using corticosteroids, an Ayurveda physician, effectively, he can manage the psoriasis condition. That is a plus point. And we know that the side effects on corticosteroids, etc., if they use it for a longer period, they may become hypertensive. Patient may become diabetic and all. The different endocrine, the disorders, they may start. And even that osteoporotic conditions may start. For that purpose, I think better not to use corticosteroids because this disease cannot be treated 100%. So you have to use the medicines for a longer period. In that case, I think it is not a good choice to go for the corticosteroids. Next is also interesting. That is lithium group of drugs. These lithium group of drugs, they are indicated for depression. See, if the person suffers with the psoriasis for a longer period, 4 to 5 years, 10 years like that, they will be under depression. Then they are giving antidepressants. That antidepressant, if it contains lithium, that causes psoriasis. So this is what we are not aware of it. If the patient comes with the medicines and all, see that is it contains lithium, then you have to stop it. So here also Ayurveda plays the main role. We can use Brahmi Grata. Brahmi Grata, it treats, that is the Kidipa also, that Kushta also. So with that, it is not necessary to use the antidepressants. And you can go with Takradara, like very safe line of treatment it is, without using the antidepressants. So that's a plus point with the Ayurveda management of the psoriasis. I told the cause of psoriasis still it is not understood completely. What is the cause and all? So whatever we are speaking, all these things are the triggering factors only. They told the chronic infections, that cold, I told streptococcal infection, tonsillitis, etc. So they may cause. Then excessive intake of alcohol, smoking, and obesity. I think in obese patient, that incident rate is more related to the psoriasis. So this is what we should be aware of this one. That is the STDs, especially that HIV infected patient if they are there. People with advanced HIV often exhibit psoriasis, and it is very severe in those patients. Okay, without HIV also it may be there. The serious condition of the HIV, that is the psoriasis, may be there. I will show that one image of that one patient, how much serious patient I got it, but he is not infected with HIV. It may be there, it is, but confirm it. So if it is there, then for the safety purpose, we may not go for the Raktamokshana, such a line of treatment and all. So with that, it is very difficult to manage such a conditions. We have to treat that HIV also for that purpose, or to check it. So very serious condition, the condition of psoriasis is there, then check for HIV also. Then prevalence rate is much more in that HIV positive the patients it is. Even the genetic factors are also told. The 1/3 of the patients are having the positive family history. It is linked with HLA antigen. Okay, so this is then I told cold climate and immunological factors. So they also plays the role in causing the psoriasis. Okay, the basic pathology is the psoriasis appears to be largely a disorder of keratinization. So this is a disease related to the keratinization. That's all. The basic defect is the rapid replacement of epidermis in psoriatic lesion. So that epidermis is very rapidly it is replaced. How much rapidly? 3 to 4 days instead of 28 days. So epidermis is replaced for every 28 days. But in psoriatic patients, 3 to 4 days, within 3 to 4 days, it is replaced. So because of that, we are getting that scaling of the skin and all, we are going to get it. And most oftenly, we'll diagnose the cases of psoriasis based on clinical examination only. Okay, we can diagnose it. Other than that, you may go for skin biopsy and all, but it is not necessary. It's not necessary. Clinically, we can diagnose it. So mainly in the contemporary medicine, we are having two signs. That is candle grease sign. Candle grease sign, if you scratch that candle, white powder-like thing, it comes out. Similarly, here in the psoriasis also, if you scratch the skin, if you rub it, then that powder-like thing you are going to get it. Candle grease sign. That is what I told. That is kinakaras parsham. Kina vanavastuhu chakapanisis that can be taken. When aspid sign, if you remove that scalings, just beneath that scalings, you will get that hemorrhagic spots. Hemorrhagic spots, that sign is called as aspid sign. These two signs, I think, they will diagnose that is the psoriasis status. And if necessary, you may go for skin biopsy. Most probably, it is not needed. It's common line of treatment. These are the treatments commonly. It is done for all the pustas, similar to the also. We go for the Kshodana, Vamana Virechana, Shirovirechana, rarely. We'll go for Vamana Virechana, but I think rarely we'll go for Nasya in Kusta. If it is Shirogataha, so especially in the psoriasis, it is scalp psoriasis, we are telling it. Okay, the scalp psoriasis, we are telling it. In that condition, we have to go for the Nasya. Then Raktamokshana. Next is the Basti. If you see that list of Ayogyas in a Basti, the Kushta is one among them. Kushta Rogi is Ayogya for the Basti. But still, in Charka Samhita, Kushta Chikista, they told Basti, that Darvadi, Niro Basti, that is told. Then I think why they told? Because if you go for the Chikista Sutra, there also Snehapana is told, but not the Basti. So repeatedly, Shodhana Karmas are told, Pakshat Vamanam, Masad Virechanam and all, repeated Shodhana Karmas. We are using Tikta Kashaya Rasatmaka Druvyas mainly in that Kushtaha. So these things, they may aggravate Vata dosha. If Vata is aggravated in Kushta Rogi, then to subside that Vataha, to counteract that Vataha, you have to go for the Basti. I think this is not the main line of treatment that is Kushta. Okay? So with this regard also, I got one patient. Same, one patient of psoriasis. He had almost 15 years of history. So repeatedly means in 1 year, 2 times Vamana and 2 times Virechana, I went for that. Then used Tikta Kashaya Rasatmaka Druvyas. That psoriasis subsided. But the patient got very severe cracks in the foot and palm. In the foot and palm, he got very severe cracks, much painful with bleeding. Then I thought it is a crack only. Then with some of the ointments, then Jatayatela and all for the applications given, even that Mahatikta internally it was given, but not subsiding for 15 to 20 days. Then I got this concept that is Basti to be given in the Kushtaha. Then I thought because of repeated Shodhana Karma by using Tikta Kashaya Rasatmaka Druvyas, there is Vata Prakopa. Then with not with Darvadi, I went that is Niro Basti with Triflak Vata and Triflaji Taila, that is used for the Basti. then within 8 days, all these cracks and all this subsided. So that is what underlying. Nothing is strictly contraindicated in Ayurveda. According to Avastha, we have to use it. So if you see in Charka Siddhisthana, they told Kushtarogi is Ayurveda for Basti. But in Chikisthana, they are telling the Basti. I think this is the reason. Because of repeated Shodhana, by using Tikta Kashaya Rasatmaka Dravyas, there may be the Vata Prakopaha. In that condition, we can go for the Basti to subside the Vata. This is not the main line of treatment for the Kushta. Then even that Bhiparmarjana Chikitsa plays important role, like Parisheka. So mainly we are using Aragodapatra Kashayam, Parisheka. So in the beginning stage also we can go for that. So that scalings can be removed. So then the patient gets the relief from the itching and all for that purpose. Then Takradhara with Triphala, Panchavalakalaha, Aragodapatra and all with that Takradhara. So that can also be conducted. I told the conditions. So scalp psoriasis, or the patient is having the anxiety, stress and strain, if it is there, in such a patients also, we can go for Takradhara. Takradhara is having the effect, local effect also. That is also there it is. And if it is psychosomatic, that plays main role. In such a conditions, we can go for the Takradhara. Shamana yogas, all of us are using Shamana yogas, but we should think about the condition. In which condition or in which stage how to use which yoga. A number of that yogas are told in the classics, but it should be dependent on the different stages. You have to understand. For example, Panchatikta Grataha. Okay, if you see that skin lesions, if it is Ruksha and Kandu, if it is there you have to use Panchatikta Grata like Gratas. Then coming to Mahatikta Grata, this is an interesting Grataha. The name is Tiktaha, Mahatiktaha. But the main ingredient is Amlikeswarasa. Okay. We see that classically, they told Tikta Rasatmaka was one part, Amlikeswarasa equal to that one. That much of Mata Amlikeswarasa it is there. So Amlikeswarasa is the main ingredient in Mahatikta Gratha. It is Sita Virya. It is. So I will take Mahatikta Gratha as Sita Snehad, Sita Snigdaha. For that, if that Rakta and Pitta Pradhanaha, I told in Kushtaha, so take this concept for all the kustas, not only for kitty band, that is Eka Kushtaha it is. In Kushtaha, if it occurs because of Ushna Hetu is there and Rukshta it is there. Ushna and Rukshaha. There better to use Mahatikta Grata. Other Tikta Gratas are there, Panchatikta Gugulu Grata and all. So you cannot replace it. Because in Panchatikta Gugulu Grataha, Ushna Virya like Balataka it is there. We cannot use it. We must use Mahatikta Grataha if there are Ushna Hetus. Ushna Hetu means by exposing to sunlight, it started, and by exposing to sunlight, it may aggravate. Okay, such a things are there. So then we can ask the history. If it is there, then we can use Mahatikta Grata. For that also, to use Gratas, the basic concept is the patient should be Niramavastha and Agni Pradipti should be there. Niramavastha and Agni Pradipti. In that condition only, we can use the Grata. So that should be applied it is. Then Nimbadi Grata. So Nimbadi, it is also Shita and Tiktaha. So in Ruksha Kandu, if it is there, Ruksha is there and Kandu it is there. In that condition, better to use Nimbadi Grata. Then Brahmi Grata, don't forget it. So the itching is, it aggravates, especially if there is a stress. Whatever may be the type of skin disease, that itching it aggravates because of the stress. If it is there, then we must use Brahmi Grata for this Nepana. Coming to the external applications, sometimes we will take external applications granted. We are very much serious about the internal medications, but not about the external applications. But as it is the skin disease, it is there. Skin is much sensitive, especially in pathological conditions, especially in the inflammatory conditions like the psoriasis. It is much sensitive. So be careful while using the external applications. One application may aggravate the condition like anything. For that purpose, Marichadi Tailaha, it is Ushna Snigdaha. So if Ruksha it is present, Krishna Varnaha, Ghanaha, very thick lesions are present. Ghanaha, thick lesions may be there in the psoriasis, may be there in the Vicharchika also. The skin, it becomes very thick in the chronic condition of the Vicharchika and all. There also we can use it. There we can use Marichadi Taila. Once again, classic says, only after Shodhana Karma, you have to go for external applications in Kushta. So minimum, you have to go for Rakta Mokshana, Jalokavachana, etc. Then you have to start the external application in its case. Then this is Ushna Snigdaha, Marichadi Tailaha. Adityapaki Taila. That Adityapaki Taila, that it is prepared out of, especially for the Kitibaha, it is prepared out of Kotachapatra. Kotachapatra, Shweta Kotachapatra, then coconut oil, they are mixed, then it is taken in a vessel. So you have to cover that vessel with, that is one glass lid, you have to cover it, and it is kept in the sunlight for 6 to 7 days. Even the days are dependent on the season also. In the summer season, 6 to 7 days may be sufficient. Then the taila, it will go on getting first that greenish color, then somewhat that is brownish color that becomes, then you can filter it and use it. Here, Snehapaka and all, that is not necessary. That's not necessary. So that is called as Adityapaki Taila. So it is also a best that excellent application in conditions of that is Kitiba or the Eka Kusta. We can use it. This is Shita Snigdha. I think this is the best option for Ushna Hetu. In summer season, if it aggravates, there we have to use the Adityapaki Taila. Then Jataya Taila, Rokshaha Kanduhu with Vedana. And if that lesions they becomes too much dry, then that may cause the pain. There we can use Jataya Taila. Then for the Parashaka and all, we can use it. Then some other classics, they told Sarshapa Taila also. So Murchita Sarshapa Taila, that can be used. Sarshapa also Ushna and Snigdha. So in that Shita Hetus, we can use the Sarshapa Taila. So Shita Snigdha, we can take it as non-inflammatory. Okay, that is a non-inflammatory condition. Inflammatory condition, we should not use the Ushnavirya Tailas like Sarshapa. Sarshapa should not be used. And Gugulus, number of Gugulus are there. According to conditions, we can adopt it. That is Keshur Gugulu, Amutadi Gugulu, Nimbaji Gugulu. So Panchatikta Gota Gugulu and all. If it is a Hukshaha, then we can use Panchatikta Gota Gugulu. If it is a Snigdha with Kledaha, if it is there, we can use Keshur Gugulu, Amutadi Gugulu, and Nimbaji Gugulu can be used. And this is also important because in the Kushtaha, you must decide is it the Kleda is there or not it is. Because if you see that the Sapta Dravyas of Kushtaha, Tridoshas, Vata Pitta Kapaha, then that Twak Rakta Mausa Lasika, these are involved. Other than Vata, Vata is only Hukshaha. Other than Vata, others are having Snigdha and the Dravaguna. Snigdha and the Dravaguna it is. So because of that Dushta Kleda it is found. That Kleda, it becomes Tanasamsha in the Siras of the Twachaha, that goes Kushta. So main culprit for Kushta is Kleda. All the Chikistas, maybe Shodhana or the Shamanas, so I think they will focus on Rokshata to be done. Using Chitakasha Rasatmaka Dravyas, Vamana Virechana, Aktamokshana, etc., we are making the Shosha of the Kledata. For that purpose, it is done. So, and in that skin disease, especially if you take Vicharchika, sometimes Srava may be there, may not be there. If Srava is there, we'll take it as Kledaha, Sravaha. Sometimes Srava is not observed externally. Okay, externally, the skin, it looks like dye. That is the Hukshaha. But just if you scratch it, then serum secretion may start. Kleda is there. So this is what we have to observe it keenly. That is only Twacha is a Huksha. You cannot say that this is a Kleda is not there. So inside it may be there. So in Kushta Chikista, if you want to take a chance, better to take a chance with Apatapana Chikista. Rokshana Chikista, chance should be taken. Then Snigdha Chikista. Even the Mahatikta Grata, actually, they are told it is. But absolutely in Rokshata, we can use it. But not when that Kleda is there. That care should be taken. Kledata. That is the main culprit to cause the Kushtaha. In such a Kleda Avastha, Kesho Gugulu, Amutadi Gugulu, Nimbadi Gugulu, these the Gugulus can be used. If it is a Rukshaha, then we can use it Panchadikta Gugulu and all. So these things. Then the Manasa Vatakam, especially a number of drugs are there for psychological factors and all, Sapaganda, etc. These things are there. But Manasa Mitra Vatakam having such a combination, it works in skin disease also and in the psychological factors also. So in psychosomatic skin disorders, I think the best drug of choice is Manasa Mitra Vatakam. So don't forget the psychological factors in treating the psoriasis. Rasamanikya, once again, Kleda and Sravaha. So deciding Kleda also clinically it is very important. Not only Srava decides Kleda, only a shining. For example, if a patient of Mukadushika is there, and Mukadushika, there might be Mukadushika is having a shining that indicates Kleda. So there also you must go for the Bhukshana Chikista only. So in such a conditions where there is a Kledaha, there we can use that Rasamanikya. Then Gandhaka Rasana, especially after Manibhadra Gudaha, that is the best that yoga as a Nitya Virechaka, we can use it in the Kushtas. Then Leh has like Amruta Phalatakaha, after Shodhana Karma, we have to use it. Especially in Shita Rutu, it is better to prefer Amruta Phalatakaha, not in Ushna Rutus. And in Vata Kaha Prakriti, there we can use the Amruta Phalataka Leya, that is the best thing it is. Then Rasayanas, I'm also using Madhusmini Rasayana. 3 to 6 months. Aristas, Khajirarishtaha, Kwatas, we can use it, Panchadikta Kwatam, Panchavalkala Kwataha. Internally also for the purpose of Parishekaha. Don't forget that Parishek, these are that I think the different modalities, even though they look very simple and very small procedures, but they give that is very good result. So one is Parishekaha, second is Dhupanaha. Dhupanaha, we are thinking only for the Vanadhupanaha, but even in the condition present, so they are also better to go for the Vanadhupana. So very that is easily and very fast that part it becomes Roksha. Roksha it is by the Dhupanaha. So you should not forget for the Dhupana also. Okay? Then Kvata, Siddharthaka, Kvata, Churnaha, these things can be used. Then we'll come to a case. It is, let us understand applied aspect of this one. Eka Kushtaha. I selected this case because it was much complicated. So other the psoriasis and all, there is no secretion. But this patient had that first discharge. Very foul smelling. Foul smelling means we cannot stand up in that OPD also. That much of foul smelling it was there. So there was an interesting case and adopted a multiple line of treatment, not one or two, multiple line of treatment. Then we got the results. It is for that purpose I'm sharing this clinical study with you. See that the chief complaints, it is a female patient. We had almost 23 years old, maybe. Female patient, 20 years old patient that she was married. That patient came to our OPDs. Okay, so see that lesions and all, but we have taken the photographs only of the palm. Patient had that lesions all over the body. All over the body lesions were there, very severe itching, disturbed sleep and secretions were there. And I told already foul smelling since 1 year. 1 year the patient had. Then especially over that palm, so skin was not flexible. Over the palm also, that is affected very severely. Because of that, the skin lost its flexibility over the palm, and because of that, there is a pain. Okay, in the palms. Other illness and all, just 1 year back, there is no problem at all, and it gradually started with small pus-filled pustules. So this is a pustule of psoriasis. Small pus-filled pustules, they were there, especially over the fingers. It was started in the beginning stage, and gradually scaling started over the skin and falling of nails. So the patient lost that nails also, and even that nail bed is also affected. That much a severe condition. So what I have seen. And these pustules, they opened and spreaded all over the body, and then discharge it was started. So just after 6 months, it erupted over the back also. So gradual spreads all over the body. Just 1 month back, lesions started over the scalp and dryness and itching even over the scalp. The scalp also inward. The thing is about the past history and all. The patient was not diabetic, and even I checked for STDs. Already I told HIV-like infections and all they may cause. So that was also negative in that. Then family history, nobody had such a history. Environmental, one history she had, that is they are working in the agricultural lands and all. They are the farmers. So they may be exposed to the pesticides and fertilizers. So that also may be that is the cause for the that is the Kushta, that is the Kitibha. As itching is there, severe itching. Patient had disturbed sleep. There is a loss of appetite, and we got that menstruation and stool. There is no problem. Menstruation, everything is normal. In skin examination, lesions are all over the body. That is silvery whitish. The discoloration it was there. Secretion, I had given that grading also 2+. So that much secretion it was there. Foul smelling. Then that is aspergillus sign. That is positive over the dry lesions. Where dry lesions are there, then if you scratch it, then you can get that hemorrhagic spots. Aspicin is present over the dry lesions. Okay, in wet lesions, there is a pus discharge. See that photograph. Observe it carefully, because other psoriasis also I have seen. But in this patient, the patient lost that tissue. The patient lost the tissue itself over that part it is. Okay, so if it is a condition, definitely she cannot flex it properly. So because of that, she had that pain. And even her hands also had very foul smelling. Through that openings and all, there is the discharge, and even you can see that the pustules here and there, 1 or 2 still it is there. So they open and the secretion it was started. This is the beginning stage. The patient had still the picture is clear. Okay. In the thumb we can see that nails and nail bed that is affected. That is okay, that much of severe condition, very severe. The patient, what I have seen, this is the case. See, still the image is clear. How much affected it is. And silver scales, we can see that one all over the palm. Now this is a good picture still. You can see, just see that how much it is affected, isn't? Each and every finger, palm and all, everything is affected in this case. Investigations I told, tried out it was negative. Then first day patient admitted. So usually Raktamokshana and all after Shodhanakam we have to go for that. But already told the patient had Agnimadya. But the patient had very severe itching. At least we should decrease the itching, the condu. So you may go for any external applications all over the body and all. It is not possible to decrease it only by that is applications and all. So for that purpose, before starting that Shodhana karmas, means that other panchakarmas, Omanavirachana, etc., I went for Siraveda. The place I selected is 4 angula abodhi gulfasandhi. 4 angula abodhi gulfasandhis. So there I went for Siraveda. Why that place is selected? So many other places are there. With hands also you can go for the Siraveda. I think the most latter, that is the distant part of that body, that is the Gulfasandhi. So from there, if you go for the show, that is Raktamokshana, then all over the Shariraha, you can go for the Shodhanatis. So for that purpose, it is the most distant part of the body. So I selected that is 4 angula abodhi Gulfasandhi for the Siravadatis. Then from 3rd to 9th day, with that Trifloquat 50 ml in the morning, an empty stomach is given. We can plan for Shodhana karmas, but the patient was very weak. Already so many years she suffered, and the patient had a malnutrition also. So as there is I told pus discharge and all it is there. Because of secondary infections, the patient had that is a dryness of the patient had that fever also. Okay. So for that purpose, I went for Cephaloquata on empty stomach, then Parsheka with Panchavalkala Quata. And next. Trikutu Chuna, 3 grams BD. I told the patient had Agnimadya. So I went for that Trikutu Chuna before food with hot water. Then strictly diet is told, which is salt-free and light food it was given. To avoid it, all types of oil items, the snigdhaharas and that non-veg also, it is avoided completely. See that 9th day, what is the observation? On 9th day, there is no foul smelling. Still variational like classical, the Shodhanas are not given. We went for Siraveda only, then Parishaka and all. With that, Shaman Yogas are given. Now there is no foul smelling, no secretions. Appetite is improved. Because to go for Snehapana for classical Virechana, so Agni should be in Prakrita Avastha. For that purpose, I did all these things. Then appetite improved. Then there is no pustules, but plaques are present. There are no pustules, but plaques are present with itching and pain. That is there still. The palms are not flexible and the pain is persisting. The patient had very severe pain over the palms. It is. So why I am telling this, all these things is how to choose the drugs and the procedures according to different avasthas. according to different avasthas, how to select the different medicines and different procedures. Because once the patient comes as a kushtaha, one thing we were having in our mind, that is the bodosha avastha, I must go for snehapana and shodhanaha. In the beginning stage itself, if you go for the snehapanaha, already the inflammatory condition. And we are telling after snehapana, dosha utklesh occurs, it increases conduit and all, then inflammatory condition may aggravate. For that purpose, in the beginning stage, if this is the condition of the patient, in the beginning stage, I think all these line of treatment should be adopted. That is okay. Then the palms are not flexible and the pain is persisting. Then this is why I went for the Siravada and all. The patient is physically not fit for that Vamana. She has the Dorbalya, general weakness it was there. And variation was planned for those who better, I think, better to woman we want to go for the variation. Then on 10th day, I started Snehapana with 30 ml of that Panchadikta Ghata and all. It started. Then gradually it was increased. So virtuous Snigdhata, it was observed on the 3rd day. It was observed that the virtuous Snigdhata. Then we went with that is Virechana with that Abhyanga. It is before to that Abhyanga with Kudaja Aditya Pakitaila. I told Aditya Pakitaila already. Kudaja Aditya Pakitaila that was selected for the Abhyanga. It is then not Swedanaha. We went for Ushnaja Snanaha. Even the Kushtabhogi is Ayogya for the Swedanaha, and the patient had also had that secretions and all. It is an inflammatory condition. So see this one also. In Kushtaha, don't go for Bhashpasvedana directly. Bhashpasvedana. So once again, it may aggravate. Within one sitting, I think, if you go for Bhashpasvedana for one sitting, it aggravates the condition. For that purpose, so don't go for the Bhashpasvedana in such a cases. Then we have given that 30 grams and 20 Vegas they observed. We went for the Samsodhana Kama. Day, these are the observations after Shodhana. After Shodhana. After and that Rakta Moksha, Siravada I told, there is no Sava. But no Sava started. Because we started snake, it is a finished thing. So that's after Sava, it so like that. And Alpha not disturb. So we'll continue, madam. Is it audible, madam?
Yes, ma'am. Yes, sir. Can continue.
Video. Is it audible?
Yes, sir. Yes.
Okay. Okay. So okay, thank you. On 16th day, these are the observations. Okay, alpha conduit is there, then still the pustules they are there, and there is no change in the color of the lesions. Color was as it is, and there is no foul smelling. There is no foul smelling. Next. So this is after Shodhana. I think you can recollect that image, how it was before Shodhana, lot of cuts and wounds and all. I think you observed that secretions and all. So this is only after the Shodhana karma, that one course of that is and very we got this much of the improvement. Then this is what after Shodhana karmas. The last slides, how it was before Shodhana it is. Okay. Now the cut thing it was healed, but scalings are there. Scalings are still. Then the patient discharged on 16th day with these medications. So capsule Tiktambuta, it is one of the patent medicine available in Karnataka that contains Vasa, Guruchihi, that Nimbaha, Kantakari and all such a the Durgas are there. So taking the name of the patent medicines also, because what I lesions are dry, where the secretions we should not go for that, and this is out practically not adapted. Where there is a Srabaha, there we should not go for external application. But after Shodhana Shamana Chikistas, nobody can say where there is a Rukshata, there should go for external applications. If the Sravate is there we should not use any Trilas or any ointments for the external application at this. It would these are the medicines, and after 19th day, 19 days, after 19 days is the observation. Srava is present only in both the palms. In other parts of the Sharira, so there is no secretions and all. The pustules are present still, condu is present, and there is no change in the color of the lesions. There is no flexibility in the palms. So in the palms, it is continued. They are painful, and there is itching and secretion that is continued in the palms. It is. So pain is persisting, and there is no foul smelling. So patient was discharged with that medicines and all, and patient is readmitted, and Parisheka is done with Nimbapatra Kwatha. Nimbapatra Kwatha, Parisheka went for that. Then Jalukavacharana, it is done over the palms. Jalukavacharana it is done. Then same capsule Tiktamutaha. Then I went for that Kaishor Guguluhu. So that is why I selected Kaishor Guguluhu is especially in that Kushtaha, in Tvacha Vikaras. So wherever there is a pain, the Vena it is there. That indicates involvement of Vata and Rakta. Vata and Rakta. In such a conditions, we have to go for Vata Rakta line of treatment. I told that is a Kushta is having multi-dimensionalities. So Kaishogul told for the that is Vata Rakta. Vata Rakta. For that purpose, I told it is pain. It is there in the palms. For that, I selected Kaishogulu. Then the Tiktam that was continued. Capsule was continued. Then on 24th day, there is no Puyasrava and there is no pustules. Condu, little bit condu, occasional, it is there. And there is change in the color of the skin. This is observed. Change in the color of the skin. from the Shavana to the Raghavana, a pinkish that change color in the skin color that was changed. Skin over the palms was not flexible. Still, it is there. Severe pain that is there. Severe pain it is there in the palms, okay? But there are no secretions over the palms. Then on 24th day, I went for Parasheka with Jatadi Tailaha over the Hastaha, over the palms. I went for that because it was completely dry. Patient is not able to flex it. So with Jatadi, I went for the Parasheka to make it Snigdaha. Okay, then tablet Gandhaka Rasayana, then Panchadikta Gota, that is a 15 ml, because already Roxa is absorbed. Because of Roxa itself, there is a pain. For that Panchadikta Grataha, that 15 ml BD that was used, then ointment Suvaralin for the external applications, we used it. Okay, now, on 31st day, up to 31st day, the same treatment, means for 1 week, the same line of treatment was followed with the Parasheka with Jate Taila. So on 31st day, these are the observations. There is a regional color in the palms. So much more affected part is the palmatis. Okay, so skin over the palms that was flexible. There is no conducive and pustules were observed. Still, the pustules are observed on other parts, but only on nail beds of both the thumbs the lesions were present. So lesions still they are present over the nail beds. Nail beds it is. Okay. Especially at the lower limbs, few dry, non-itching, non-scaling, hyperpigmented skin. Okay, so after healing of that psoriasis and all, that hyperpigmentation remains. That was there over the lower limbs, that was present. And patient discharged and advised to review after the 15 days with the following medicines. So the same thing, Jataya Tailaha, tablet Gandhaka Rasayanaha, Panchadikta Gata 15 ml BD it was given. Ointment Suvaralin was given for the external application. See, after 31st day, this is the observation. Just remember the first image and see that one, this one, how much it was healed. Next. Okay. Just for comparison, I'm keeping this slide. So this is the first day, left and right palm. Left and right palm, you can observe it. So how much lesions and all it was there, how much affected. So this is the second slide after Shodhana Karma. After Shodhana Karma, you can see that the improvement. Then after all the Shamana Chikitsa on 31st day, so this is the improvement. This is the improvement we observed. Then the patient still continued that Shamanoshadhi and all. So it was completely healed. And just I want to say, after 2 years of treatment, just I have forgotten that patient, 2 to 3 years, she met and she actually, because of this reason, it was a lot of secretion, scaling, false smelling and all. She was married 5 years ago, but husband left her because of this problem. But once again, she went with the husband and all. Then she got pregnant, delivered a male baby. After 3 years, she told me. So I'm happy about it because one family was protected after the treatment and all. So this is the improvement we got it after all the Shodha and Shamana Chikitsas. And this is there still slides are there, other slides. Some other, in short, I am telling. The patients of psoriasis we treated. So this is the one case after that Vamana Karma. This is the result. So you can compare it, I think, the skin color before and after Shodhana Karmas, before and after, you can see that one. How much improvement, almost see that one, the below one, that slide it is. So there is no lesions at all, So, okay, this is over the abdomen. You can see that very big lesions before the treatment. Then after the treatment, see that improvement. Okay, so end results, we can observe it. Okay, so that is the improvement after all the treatment it is. This is a very severe condition, age about 50, 55 years old patient. So he is also not fit for the Shodhana Karma. We went for only that Shamana Chikitsas. Only Shamana Chikitsa we went for that. So see that before and after results. He had taken treatment in all the centers, almost all the centers. So this is the result after that is a treatment that is the last follow-up what we have. This is a very severe case of the psoriasis. A patient of, and he is also in Ayurveda graduate, is doing that BMS course in some other colleges. So see that one, how much serious a condition is it. Okay. It was inflammatory. See that calf muscles, they are of that how it is inflamed, and even the secretion was there. Oozing it was there from different parts and all. The patient is not able to bend his knee joint, all the joints. He is not able to move that neck also. There is no movement in the neck, back and all, that even that hands and all. So there is no movement. That much a very serious condition I got. But it is interesting that even I went for the investigation, that is HIV and all, everything, it was negative. It was negative. See the next case. See, this is the same case. That boy I told. See that seriousness it is. He suffered a lot. There is no sleep. He's crying like anything. Much inflammatory condition. Very serious case. What I got in my experience. We went for, and all these things are not done. We went for that Jaluka Vachakana in this patient. Jaluka Vachakana. So you can see that the pinkish discoloration. So that indicates inflammatory condition, and Ushna Spashet was there. So for that we went for Jaluka Vacharana and Kasheka and all, but still we are not able to get the result. Just for our information, I'm keeping that slide. How much serious condition may be there? That's psoriasis and all. For that purpose, I'm showing, and I want to share another one thing with this patient. In some of the patients, we went for the Taila Bindu Pariksha, Mutra Pariksha. Commonly, we are doing that one. Okay, this is very interesting. Out of interest, I went for that. It is some other cases I will share. That is, we treated Gradrasi, one patient. It is that patient, he was operated for twice. He was operated for twice for that disc bulge. He operated twice, and he was a professor in a college. He came to us, very severe pain he had, and he is bending like anything. He cannot walk straight. Much of pain. Then went for the Panapachana, then I told for the Panchakarma, for the Basti and all. But I'm not sure about the results. I told the same thing to the patient. Already you operated for twice, the guarantee cannot be given. But on first day of before starting the Panchakarma, first day itself, we went for the Taila Bindu Pariksha of the Mutra Pariksha. So, you know the directions and all, according to that direction. So, in Pratakala, before sunrise, we collected that Mutra. After sunrise, we observed it. Then it showed that this is Sadhya. And this is amazing thing for me. All the patient operated 2 times, then how it becomes Sadhya? So, I think it may be wrong. So just we're imagining those things and all. See, we went for the treatment for 8 days. Only Yoga Basti, only for 8 days, we have given it. On 8 days, after 80% result the patient got. This is interesting for me. The same Telebindu Pariksha I did in number of patients. So I left the patient, then we wanted to do that attendance of the patients and yoked. After so many efforts also, it is not at all effect such a Parikshas also. So don't go behind scientific reasons always. So that Ayurveda is having its own dimension. It is above than any of the scientific reasons. Our yukti may not work. First and foremost thing is we must believe Aptopadesha. Must be the Aptopadesha, because the treatments are much costlier. It is better to decide is it possible to treat it or not. With other lakshanas and all, we should go for the Mutra Bindu, that is a Bindu Pariksha, Saila Bindu Pariksha also. This is the case it is, what I did then. So these are the other cases. I think in this patient, we went for the Shodhana Karmas. Then before and after, we can see that results. This is scalp psoriasis. You can see the small lesions over the scalp psoriasis. In this patient, we went for the Vamana Karma. Vamana is dead. See this one. How much lesions are there? Okay. So in this patient, we went for Vamana. After the Vamana is the end of, after the treatment, you can see that improvement in this patient. This is the case. Okay. And this is what I told in Grishma Rutu, the patient came to me in hot summer. See, I think you can appreciate the inflammation. Okay, you can see that inflammation, the pinkish discoloration of the skin. In this patient, instead of going to the classical line of treatment, the Kitiba and all, I went for the Sariva and Ushira. That is, I told the patient the kit is given, then the Sariva, that is a Parisheka. So, Sariva, the Kashan Parisheka, I told. So, then the patient, it was improved after that Shamoshadi only. So, that is, the Shodhana Karma is not done in this patient also, went for the Shamana Chikitsa. So, in this patient, after treatment, that is, the images are not available. So, these are the few patients they are treated. So, what I'm telling is, I'm not treated these things because of blessings of Punosathraya, the Gurus, and God Dhanvantari. So, I got a chance to treat such a patients. Whatever that the things, it goes to the Punosathraya, the Gurus, and that God Dhanvantari only. So, with this, I'm concluding my speech. I'm very much thankful to the organizers and Dr. Nagaratna Magiri, madam, and other organizers and that institute also for giving me the chance to speak. Thank you, Vanyana. Thank you, Vanyana. Thank you very much.
Thank you so much, sir. That was a fabulous session and so many clinical cases you showed. Now, sir, we can proceed for Q&A session. We have few questions from the participants. And before that, sir, I have personally one question: how to we can approach in a patient of psoriasis with ulcerative colitis? I have a patient in my OPD, so he has ulcerative colitis since 6 to 7 years, and he's also psoriatic, like in foot and ankle joints, body also, head also, scalp psoriasis is there. Overall, whole body is affected. So how can we just approach to that patient?
Oh, this is the things we are getting in the practices. So, as a mathematics, we will tell that if psoriasis is there, it should be treated like this. That psoriasis may be associated with other diseases also. Then the problem starts, as Madam has told, that ulcerative colitis with that is psoriasis. The psoriasis may be any type of the kushtaha. It would we are preferring tikta rasatmaka dravyas, and this is the safer thing, I think. As ulcerative colitis it is there, you can use tikta rasatmaka dravyas. So it will take care of both. It will take care of both. But Shodhana karma and all, we should be careful. As the patient is having ulcerative colitis for that purpose, I think better, Tikta and Shita. Tikta and Shita Satya Dravyaha. Tikta and Shita best is Nimbaha. That Vasa and all, we can go for that. Then Ghritas we can prefer. I told Mahatikta Ghritaha. Take care of both. Because Mahatikta Ghritaha is indicated for the Rakta Pradara. Okay, Raktas Vikaras also. So it is better to prefer so in a Samavasta. If Agni mandate is there, in the beginning stage, go with Kashayas. Kashayas of Vasaha, Nimba and all. With that Kashayas, we can go for that. Later in Nirama Vasta, we can prefer Mahatikta Grita internally. External application, there is no problem. Think we can manage it like this. Because both are such a conditions. Also the colitis and that psoriasis. So it can manage with Tikta Rukshaha and Tikta Snigdha. So that concept can be applied according to Samavastha and the Niramavastha. We can
And
prefer
sir, for Shodhan therapy, it is difficult to do in that person because his Agni was also Mandya. He was not feeling any kind of appetite, also very poor. And I tried for that Agni Deepan also for 4 to 5 days, but no result was obtained. His Agni was not like very good for Snehapan. So then I gave him some Shaman Oshadis and then I discharged that patient from IPT.
Yes, madam, it is very difficult to manage these conditions. I told both are like that only conditions. So better I told that Tikta we have to prefer. Okay, the Tikta Ruksha and Tikta Snigdha. So once there is Nirama, we can prefer. So Shodhana Karma, I think it is not possible to conduct in such a patients. Possible, I think, if possible, by seeing the condition of the patient, we may go for Siraveda. But by seeing the conditions, we can go for the Siraveda. Not woman and variations. Not woman variations.
Okay. So next we will go with some questions from our participants. So one of the participants is asking Poonam Bhojak. She is asking in a case
Any
of
other
scalp
questions?
psoriasis. In a case of scalp psoriasis, Takradhara followed by Patoladi Churna Lepa in a patient resulted as good response, as you mentioned in the session for Takradhara. But post 2 months, the same patient after coming from a trekking trip developed white scaly patches appearance only on the arms. What could be the reason and how should the follow-up be?
This is what the change in the atmosphere definitely it leads to that one. So as the picnic and all, the change in the atmosphere that aggravates the condition. It is so scalp psoriasis. Takradara gives the result, but it becomes a temporary. So better if the patient is fit for that. One course of that is specially Vamanaha. If it's only scalp psoriasis, so I can say that guarantee results can be given after that is Vamana, after Vamanitis. So better to go for the Vamanitis. Then we can use that Aditya Pakitaila, as it contains coconut oil only. So Aditya Pakitaila can be used for additional applications. Other Shaman Yogas, according to the condition, we can plan. But I think better we should go for Vamana only.
Okay, sir. Another one question is that in Kushta patients, sometimes there is aggravation of Kandu, especially when Snehapan doses are increased or followed Snehapan during Abhyanga period. In such patients, how to plan Shodhan? Sometimes patients refuse to continue.
So somewhere in the session I told, be careful to start that Snehapana. We should not make urgent because main culprit to cause Kushta is Kledaha. So that Saptadravas of Kushta, if you see that one, Tridoshaha, Tvak Rakta Mausalasika, only Vata is Rukshaha. Others are having that is Snigdha, the Dravagunas. So Kleda is the main culprit. We must go for Apatapana line of treatment and Kushta is Santapana Janavikara. So take a chance with Apatarpana, not with the Santapana in the beginning. Even though before Shodhana, we'll go for Dipana Pachana, sometimes we may limit that period 3 days, 5 days, 7 days, like that. Don't limit it. Still, at clear that it decreases, complete Agni Pradipti it is there. Maybe it may take 15 to 20 days also. Up to that, you must go for the better is Tikta Deepana. Tikta Deepana like Guduchadi Kasham and all. That should be used after proper, that is Deepana Pachanas Rokshanaha. Then other line of treatment can be done. It is not only Deepana Pachana. During that period, you may go for Parisheka and all with that Trifla Nimbaha. So that also at by Tvachaha, that also increase that Rukshita, means that it comes down by that Parisheka. Then we can go for Snehapana. So directly if you go for the Snehapana, then definitely it may aggravate the condition. We can go with some of the Shamoshadi also, Nimbadi Gugul, etc. These things should be used in the beginning stage. Kondu should decrease. Then after some days, we have to start Snehapana. Otherwise, it aggravates the patient, cannot tolerate. That is there.
Okay, sir. Dr. Shri R. Nair, she is asking, can you please explain the role of Rakta Mokshan and which type is most suitable if Shiraved is possible to do in every psoriasis case?
So if you take psoriasis classically, it's Vata Kapha. As a basic idea, we are telling that is Rakta Mokshan done in the Rakta and Pitta Pradhana condition. But a number of conditions we are seeing that in Kapajaha, Vataja, like Ghadrasi and all, they told Siravadaha. So that is there. We can go for Siravada and other doshas also. That is there. But in Kushta Chikitsa and Chaka Samhita, they are telling the condition for Siravada. If almost all over the body lesions are there, multiple patches are there, so there we can go for the Siravada. If 1 or 2 patches, if it is present, you can go for Jalukavachana and all. So otherwise, you can go for the Siravada. So almost in psoriasis, I think that the most of the part it is covered. So in such conditions, I told in scalp psoriasis, not necessary to go for the Siravada. Okay. In other parts, if it is there, almost all part of the body, if it is affected, they're better to go for the Siravada. Especially I told there may be the Raga Varna. Classic says Vata Kapaha. But I have shown that patients with pinkish discoloration of the skin and all, inflammatory condition. If it is inflammatory condition, Ushna Sparsha it is there, then better to go for the Siravada that gives immediate effect. It decreases the counter decrease after the Siravada. But Siravada itself is not complete line of treatment. After that, we must go for the Shodhana karmas like woman and variation, etc. According to condition that should be done. That is also necessary.
Okay. So one more question is from Shivam. He is asking, modern medicine says psoriasis can be controlled but not cured. can Ayurveda cure it by balancing body system? So is there any permanent cure or intermittently we have to give therapies like in patients?
Okay. So, see, I have seen that mixed patients. In some patients, only Shamana had given, there is no reoccurrence at all for 4 to 5 years. In some other patients, I had given Vamana, only one course. One course Vamana, 2 to 3 medications after 10 years also. So the patients are still in my contact. That after 10 years also, there is no reoccurrence. In some other patients, Vamana is given, Shamasas are given repeatedly, but still there is reoccurrence. So this is what we cannot guess it. Don't give the guarantee to the patient. And don't forget that Kushta is also Karmaja Vyadhi. So I had forgotten that one. If necessary, go for Daya Pasha Chikista. Okay, if the patient is able to follow it, is ready to follow it, then advise Daya Pasha Chikista also. So this Karmajaha, that concept it is there, it's not a theory. It's not a theory. If you go in depth, you will understand it. Definitely, it plays a very important role. So because of that, guarantee cannot be given. So that this is the condition you have to explain the patient. That we will try our level best. Some of the patients we got the results, there is no reoccurrence at all. Some of the patient it is there. So better you should try with the Shodhana and the Shamana both it is. So guarantee cannot be given in this condition.
Yes, sir. It differs from person to person. So how their body responds to the therapy, I think that maybe.
Yes, madam. Yes, madam.
Sir, one more question is from Dr. C. Srishti Shetty. He is asking, there was a patient, male patient who was a bike rider previously and used to wear gloves. But presently from 7 years, he stopped riding. He has got brittle nails on both upper and lower limbs since 8 to 9 years, and gradually he has lost all the nails and even nail bed constriction is seen. However, there is no other skin lesions or any part of the body. When new nail appears, it is also dark and loose. So what should be the approach for this patient?
So as the patient is very specific, after leaving that wearing the gloves and all, it was started, then they must wear it. So I think the external atmosphere is becoming a triggering factor for them. Maybe their profession and all, it may be like that. So we are having one patient with that Vichachika. So every year in the June month, he comes to me. Exactly June month it is. So it aggravates. The Vichachika starts. First and second year I have seen it. Then I told, just if itching it starts, you should come to me. Because it was very severe in the beginning. In the first time when they came to me, it was very severe. Then I asked about him. He is a farmer. The June, July month is the raining season in Karnataka. It is. He used to start the profession in that month only. So because of that, he got it. Okay. Then I told to avoid all those things, at least to wear that shoes. So up to the knee joint, you have to wear that shoes and all. Then he have to work. So that care should be taken as usual. What I told the treatment for that Kiddipa and all. This line of treatment, if necessary, our patient is fit for that, we can go for Shodhana Kama and other Shamana Chikistas. But if the profession is there, then they must wear the gloves or the shoes and all. That is essential.
Yes. So one more question is that what is the treatment for drug-induced psoriasis?
We told some of the drugs already. So if the patient is taking the antidepressants, better to stop it. Okay, not to stop immediately. That care should be taken with that Takradhara. I told Takradhara and what we are telling it as it is in Ayurveda, which contains Sarpagandha and all. I told the Bhami Krataha. So those things can be given. And especially corticosteroids. Okay, you can tapering dose, stop it. Don't stop it immediately. Then with that, we have to start the Ayurvedic medicines and all. Gradually, you must stop corticosteroids. It's very difficult. The patient is already under corticosteroid, is very difficult, but we should take that risk. Don't go for Shodhana Kama in those patients. So first, with tapering dose and all, they must give that corticosteroids and go on increasing the dose of the Ayurvedic medicines. Then we can manage it. So anyhow, they must leave that medication. There is no any other option. There is no any other options. But in this condition, so this is best. That is one patient we got from Uday Bihar. They are using that is corticosteroids also. In that patient, I used Manasamitravati. Manasamitravati with that the antidepressant was given. Gradually, we decrease the dose and all. Now they are okay. There is no problem. So don't stop that medications, and we should give the medicines of the Ayurveda. In the beginning, somewhat more doses may be needed. gradually you must decrease the dose of the Ayurvedic medicines also. But anyhow, they must give up those medicines.
Okay. And sir, next question is from Professor Vishwanath Misra, sir. He is asking that chronic case of pustular psoriasis is curable or yapya?
It is yapta only. The psoriasis is yapta only. See, I told it is dependent on karma. I told one shodhana karma may be sufficient. 10 years reoccurs may not be there. Sometimes it may reoccur within 6 months also. All the chances are.
Okay. And sir, one more participant is there. He is telling that he is suffering from psoriasis since last 5 years and it occurs in whole body, including scalp psoriasis. He is Vasaj Prakriti patient. I think he is from our participants only. So what can he do? Give some advice for him. I know you have already described all the treatment principles, but some personal advice for him.
So maybe same faculty maybe. So I'm requesting him that first go for the Prashaya that needed. At least go to the Shiva temple daily. Then with that, if possible, he can take the medications. Otherwise, meet that physician, experienced physician. So all over the body as it is there. So in the beginning stage, don't go for Shodhana Kama and Snehapana. Don't start with Snigdha Chikitsa at all in the beginning. Go for Hokshana only. Maybe Parshekaha. So internally also I told Tikta Kashaya Rasatmaka. You also take it. So if possible, go for Sirava. That also Hokshana only. We can go for the Siravadaha. If you are fit for that, or to check it, that one essential. In such a conditions, as it is there all over the body, go for Shavana Chikistas. So I'm requesting him that go for the Shiva temple, then take that Tikta Kashaya Rasatmaka Dravyas, or that Siddharthaka Kvata Chuna that is available. He can go for that bathing, either Parashekaha. Then if it is Pittaja, Kafaja and all, or to classify it according to that Tikta Ushnaha, Tikta Shitas. So I will take that Nimbadipur and Panchanimba Chonaha, these are Shitas. Ushna that is Tikta. Ushna Tikta is that is Amutaja Guguru, Gurji preparation, those medications and all. Shodhana is essential. Okay, so go for the Shodhana karmas.
Yes. Sir, one last question is from Dr. Shahida Patel. She is asking, is there any Marma Chikitsa for psoriasis?
Madam, I never tried Marma Chikitsa in that psoriasis. About that skin manifestations, I think there is no such Chikitsas. When skin manifestations, we are using that cupping therapy, but it is not useful in psoriasis-like conditions also. So I never tried Marma Chikitsa, and I never heard from any others also about it. Marma Chikitsa in psoriasis. So I don't know much about that. Marma Chikitsa in that special psoriasis, I don't know.
Okay. Okay, sir. I think all the questions are finished now. So thank you so much, sir. I will hand over this session to Dr. Sheenas VS to carry over forward and give vote of thanks to all. Dr. Sheenas?
1 minute. Sir, this side, sir, video on. Yes, ma'am.
So you can go with the vote of thanks.
Yes, yes.
Question and answer session is ended.
Am I audible, ma'am? Hello.
Yes, you're audible.
So very good evening to all of you. Today we reached our 27th Parva of PRABODHINI webinar series. As a long journey, we started from first. Our main intention to continue this program for spreading our Ayurvedic concepts to all the community, because nowadays Ayurveda is Anadi, still Ayurveda is sidelining from different communities. But today we got a very good expert, our Prasanna.V.Joshi Sir. He given that more examples, what is the real effect of Ayurveda. He showed that from his real experience. So this is the talent, this is the thing This is from the power of Dhanvantari, that spreading the great knowledge, great Shastra. So that is the purpose, the spreading this jnana to the older people. We are conducted this Prabodhini series. From that, we are calling all the experts from the different fraternity of Ayurveda subjects. So like that, today we reached our 27th Parva. So I would like to thank, first of all, our respected chairman, sir, Dr. Shailendra Yadav, sir, and our director, ma'am, Dr. Sunita Yadav. They given much more support to start this program and continuing this program for all the financial and all the support from this, and also get a great backbone this program. Our respected principal, sir, Dr. Manjunath N. sir, is given much more support to continue this program and more moral support also. So that's why we are continuing still. We are planning to continue like that only. Also, today we conducted with the help of Department of Panchakarma, our respected HOD and Professor Dr. Bishwanath Mishra sir, and Associate Professor Dr. Ningama ma'am, and Dr. Sulfit Assistant Professor ma'am, and myself, Dr. Shinas, and also all the teaching faculties from our SBSJS Ayurveda Medical College. And finally, I would like to thank our all the participants. They are the main spirit, because today itself actually they had about our Prasanna Sir class. They are very enthusiastic from 2-3 days continuously getting calls from that to join the class. They are enthusiastic to join the class. So some technical issues also to join. So that's why we'll get the spirit, how that they taken this Prabodhini to their heart. So we will give that effect for that also. So today that sir given a great story like that from what is psoriasis. So I would like to a great big thanks to our Prasanna.V.Joshi Sir to give a fantastic story like explanation of psoriasis. Sir started with that one line I quoted in the first slide itself. Read in between lines. That is already Acharyas mentioned, Tadaksharam Adhigam Mede. Not read the lines, you have to read in between the lines. So that is the great words sir quoted first only. From first slide only, I understood that that's jnana is given that much level. So that type of Vaidyas is needed in our society. So this is the great example. So requesting all of to follow that type of legends and keep that concepts and study and follow that and practice. This is the good message from that. And from this, I would like to thank all our delegates for that to follow us, and thank you all. Then one more thing that we will send all the e-certificates to all the participants within 7 days. And some of the people are giving their names like iPhone or mobile name like that. So this is the, so because of that, that same name only printed in their certificate. So please take care while filling the registration form. So then going to the national anthem, we can wind up the program. Thank you all.